All right. Hello, everybody, and welcome. I'm Dr. Trevizo, Director of Academic Operations for the College of Undergraduate Studies, and thank you so much for joining us today in the panel presentation. We have a couple of representatives and an in-house faculty member that's going to facilitate that conversation. We've had a couple of these different panel presentations in the past on different themes. So last term we had becoming a licensed counselor and therapist, and before that, undergraduate career. So if you are interested in or missed some of those sessions, I'm going to put my email in the chat. Just let me know. I can get you those recordings. But with that being said, I'll pass it over to Dr. Felice Mays, who's going to be facilitating us tonight.
Thank you so much, Dr. Trevizo. As he said, my name is Dr. Mays. Many of you I've probably had in class before. It might have been fundamentals of psychology, or it could have been social psychology. It just depends on kind of where you are in the program. But welcome. We're excited to have you here, and we're especially excited to have our two guests come in. And so, like Dr. Trevizo said, we have had different speakers come in. Some represent more of maybe your typical clinical therapy type of work. We've had others that have focused on, other arenas of more applied psychology. But today, this is all about working with kids. And so if you've explored the idea, if you've considered it, I would encourage you to take some notes and ask questions to learn a little bit more. And so while we have, many different careers out there in the helping professions, some are more clinical, some are more research, some are more applied. There are some that are even more of what I would call like a niche profession. And that's what today is. So I would like to take a minute to introduce you to Dr. Huber, who's over the school psychology program. And then I'd also like to take a moment to introduce you to Dr. Flynn, who's over our ABA program here at the Chicago School, which stands for Applied Behavior Analysis. And so first, I'd just like for each of them to introduce themselves. We'll start with Dr. Flynn, and then we'll move over to Dr. Huber, and then we'll go from there.
Thank you. Hi, everyone. My name is Dr. Susan Flynn. I'm the department chair for the online Applied Behavior Analysis programs at the Chicago School. And I'm a board certified behavior analyst at the doctoral level. And I've been in the field of applied behavior analysis for many years. It's great to be here.
Thank you so much.
And I'm Dr. Brenda Huber. I am the department chair for school psychology at the Chicago School in Chicago. And school psychology, we only have one program in school psychology, and it is on the Chicago campus. It is an in-person program. But we have a program that's at the specialist level that's similar to a master's degree with an extra year. And then we also have a doctoral program. And I've only been here on this campus for 16 months. So before that, I worked at a different university for 20 years, and I've worked in a number of different settings. And I kind of came to school psychology late. I started out as a teacher and had worked in some other settings before coming to school psychology, and I love it, and I love to talk about it. And so I'm glad to have a chance to talk to you about it.
Thank you so much. When I started my career, one of my first jobs, I worked as a crisis counselor at a high school. And so I learned about school psychology and I learned about ABA only once I got in the field. I didn't know anything really. I'd kind of heard, but didn't really know much until I met people in action doing both professions. And so I'll go ahead and just start with you, Dr. Huber, and then we'll go back to Dr. Flynn. If you could kind of explore a little bit more about what made you decide to go into the profession of school psychology.
It's interesting that you said that you learned about school psychology when you were in the schools. So I was a middle school teacher. I taught 8th grade. And I actually, if I would have only had that introduction to the school psychologist there at that school, I would have never gone into it. Because there was this guy with this suitcase, and he would run around the middle school, and I would always try to hide from him because I thought he was going to make me fill out paperwork. That's what I thought he was going to do. And so that's what I thought school psychology was. And actually, so I was a middle school teacher, and I taught language arts and communications. So I had all of these kids telling me their problems, and I was like, I really need some proper instruction. And so I went back to school for a master's degree in mental health counseling. And after I got that degree, I actually was being a foster parent while I was going to school for the master's degree and teaching. And so my next job was in therapeutic foster care, where I was doing counseling with these kids who had been in like 17 different placements before they got before I started to work with them. And once again, I was struggling with them to do therapy. And I was like, I need some more proper instruction. And so I started to explore where I wanted to get my doctorate, what I wanted to study. And I picked school psychology because I wanted to be a psychologist in the schools. I wanted to work with a whole range of students, not just kids with, severe issues, but I wanted to be able to do prevention. I wanted to be able to work with kids who are just had, like emerging problems. And school psychology is a discipline that is very systems focused. So you work with all the adults and the systems that kids are in also to prevent and help them grow up to be healthy and happy. And so that was how I got pulled into the field of school psychology. And since that, being in that field for all this time now, I also have a business outside of the schools and outside of the job at the Chicago School, where I work with whole communities, all of those systems that are worried about their children's mental health, and use the knowledge of a school psychologist to help change the systems like primary care and community mental health and juvenile court, bringing all those people together to use school psychological services and knowledge to change the way those systems work and bring about healthy, happy children. You're muted, Dr. Mays.
Thank you so much. I appreciate you sharing that. I did not know the past perspective of you being an educator before you became a school psychologist. I think it's good for our students to see that sometimes there's change throughout the career as well.
Mm-hmm.
Can go in many professions. Dr. Flynn, if you could share what made you decide to originally go into applied behavior analysis.
Sure, of course. And I think we're all in good company here. I started off as a teacher as well. I actually got my master's degree in special education, and I worked with students with a range of disabilities, from back then what we would say mild disabilities. That's what the certification was at the time, but learning disabilities, behavioral disorders. And then I started teaching students with autism. And that's really kind of where I stayed, was with students with autism. And I taught at the high school levels as well as the elementary levels. I never taught in the middle school, but yeah, it was high school and elementary. I guess what originally drew me to the field was curiosity about why people behave the way that they do, and how small systematic changes can make a big difference in someone's life. And so when I was working with kids with autism, it really interested me on why were they communicating the way they were? What were they trying to acquire? And what's a more appropriate way of doing that? And what maintains a behavior? What environmental variables maintained a person's behavior? So early on, I worked with children and adults with developmental and behavioral challenges, as I said, and I saw how behavior analysis helped individuals learn to communicate, to gain independence, to have transition into work skills after school, and connecting with others in ways that they hadn't before. And I just remember this one case of when I was teaching, working with the speech pathologist, but teaching one of my students to say hi to her mom. And I will never forget the day that she verbalized it for the first time to her mom. It was such a meaningful experience. It meant so much to me, but as obviously to the mom and to the student herself, because she was able to communicate with her mom. And I don't know, that kind of meaningful, measurable impact was and still is what inspires me every day to do what I do.
Thank you so much.
Beautiful.
Thank you.
It really was. Thank you so much. Both of you, I can tell that you have a passion for your field. It's obvious. So, Dr. Huber, if you could, you've touched on this a little bit, but if you could describe just a day in the life of a school psychologist, so people kind of have a picture. You know, you said you kind of had the preconceived idea with the guy running around with the suitcase, and he might have just been one person, but if you could kind of just give a snapshot of what that could look like if a student went into that career.
Yes. So one of the things, this is just how I am. Like, I love variety. I like to have no 2 days alike. And that's the way school psychology is. Every day you go into the school, it can be completely different. And so when I was trying to think up about, like what a typical day might be like, I made a list of things. So the first thing to know is that most school psychologists work a 10-month contract. So they start in August and they end like in May, and they work so many days for their contract, and it's pretty much 8 to 3. If they work before 8 in the morning or after 3 in the afternoon, they typically get like extra pay for that time. And sometimes those are times for like meetings and things, because that's when oftentimes parents and teachers can sit down together and stuff. But like the average salary for a school psychologist is it's a little over 100,000. And a lot of people don't realize that that's about $30,000 more than like a school counselor or a school social worker makes. And that's partly because of what I mentioned before. School psychologists get a specialist degree. So it's a longer path to being a school-based mental health professional. But most school psychologists do work in schools, and most of them either work like in most of them actually work in more than one building. Some of them, depending on the size of the district or the size of the building, are just with one. But like the national recommended ratio is like one school psychologist to 500 students. But to be honest, like in the state of Illinois, it's 1 to close to 1,300 students. So there is a huge shortage of school psychologists. So most school psychologists have more than one building that they're working in. So that's kind of like an overview, but then think about a typical day. So you might show up at your school, and the first thing you're doing is you're having a check-in with a student who is experiencing like some school refusal or some school anxiety or something like that. So you're the person, you're the friendly face that they see first thing in the morning that helps them transition from home into school, which might be a little bit of a nerve-wracking place for them. And then say you go into what's called a domain meeting. This is a meeting where you're getting together with all of the adults that are concerned about a student to try to figure out what are all the areas of functioning and where there might be concerns that you need more data, more information about. And then you set about in the coming weeks to answer questions that people have about what's going on with that child's learning or what's going on with that child's emotions or behavior, what's going on with their functioning. So that's called a domain meeting. It's where you get together and try to figure out what information do we need to answer to be able to help this child. Maybe then you go and you actually do some testing, or you go and observe some kids on the, at recess or at the playground or in art or something like that, and see how they're interacting and try to answer some of those questions. Maybe you see a couple kids for therapy. You have some therapy. Maybe you have a lunch group. You bring a bunch of kids together and you do a social skills intervention or something like that. Maybe after lunch, you meet with a teacher who has been struggling with a class or struggling with, some bullying going on, or maybe she's got a group of kids that are just not picking up on some kind of math thing she's trying to teach and wants you to help her figure out how to teach it in a different way. That's a little bit unusual. Usually she would probably go to her peers, other teachers, to figure out how to teach a math lesson, but maybe it's a reading problem or more likely a social emotional difficulty. And then maybe you kind of wrap up your afternoon with a meeting with other people who are trying to problem solve some larger systems issues. So maybe you're looking at data for your school post a pandemic where kids aren't coming to school, like attendance data or school safety data. Oftentimes, school psychologists are part of teams that are making schools safer. Or school climate. Let's say that you've got data that your school did that your LGBTQ students are not feeling safe in your school, where you're working with people to figure out how to change your school environment. Or maybe you're brainstorming with your team on how to manage ICE in your community and how you're going to get kids to and from school where they're both safe and their parents are safe. Those are the kinds of meetings that you participate in with your administrators and your other teams. And then say you wrap up that day with a check out with that student that is having those school refusal issues. And so you find out how their day went and touch base and get ready for the next day, right? So they know that you're going to see them first thing the next day. So that's just a sample of the kinds of things that you might do. And it could all go a different direction if you end up with, a child who's experiencing a crisis and you're assessing a suicide risk or something like that. But that's the kind of variety that I love, and being able to use all those different kinds of skills, both on the social, emotional, and the behavioral and the academic sides.
Thank you so much, Dr. Huber. I love how you pulled in the consultation role, the therapy role, the family system role, and then the bigger school as well. So I think you gave a great overview of that. We do have one student that's asking a question. I think this might be a good time. I usually wait till the end. But Angela says, does school psychology also give directions on how to properly work with kids with ADHD? Or is this ABA? And does this degree allow us to teach those teachers on how to work with these students?
So I can answer for school psychology. So school psychologists are both involved in sort of the assessment side of ADHD, understanding what's going on with a child in terms of where their struggles are. And then because actually troubles with paying attention, for example, or hyperactivity have a whole host of reasons. And sometimes somebody looks ADHD, but there are actually other reasons for being inattentive or overactive. So that piece, and then also being able to teach students what are called executive functioning skills, how to help compensate for executive functioning difficulties, and help teachers teach those students. So that's a big yes. We have a lot of time is spent supporting children with ADHD in school.
Thank you so much, Dr. Huber. Dr. Flynn, maybe you could answer the other part of that question as you give a day in the life of an ABA therapist.
Sure, absolutely. So a typical day as a behavior analyst really depends on your role. So some BCBAs work directly with clients in homes through home-based clinics. With schools, so typically a BCBA might be hired at the school district level, and then they're assigned schools and they're responsible for those particular schools, or actual clinics where clients go into the clinic to receive therapy. And in the school setting, to answer your question, actually had a lot of experience working with school psychologists. We actually worked very well together on developing a comprehensive program for students experiencing challenges in the school setting. And so we would carry out treatment plans specified by school psychologists or, recommended. Also through the program itself, we would have goals. We work together on IEPs, individual education plans for students if needed. And so really some good close collaboration there. And so regardless though of which setting you would work in, you would be conducting assessments as a behavior analyst, which could include surveys, checklists, parents checklists, direct observations, so collecting your data while you're observing the child in the natural setting. Also developing treatment plans based on those assessments, so making data-based decisions on those assessments, and also on the treatment plan. So you're always constantly looking at your data. You graph out your data for visual analysis, and you're always looking at those data to see if the intervention, the treatment, is actually effective. If it's not, then you know that you need to change some things, and you go back and change. But it's a continuous process. And also behavior analysts also train staff or families and teachers also. So training teachers in the school setting. I remember when I was a special education teacher, not a behavior analyst yet, we had a behavior analyst come in, and the behavior analyst was, working with one student in the classroom setting, and then was providing recommendations to me as a teacher for that student. And I thought, well, how am I going to do that? This isn't my only student in the class. I actually have multiple students, and it's a lot of juggling, responsibilities for teachers. So behavior analysts also are responsible for creating that buy-in with staff and teachers and families on.
You're muted, Dr. Mays.
I think Dr. Flynn may have glitched for a moment with her internet, so she'll pop back in just a minute, and so she'll be right back. I think what I'll do in the meantime is there's another student that sent me a message and with a question, and the question is, how much different would it be to work with pediatric patients in a health facility? And so I can kind of start to answer that, and then maybe Dr. Huber, you can add to that. So there are many different professions where you can work with children and provide psychological care, therapeutic interventions, things like that. Some are, licensed professional counselors that work within hospital settings. Some are clinical psychologists that work within, pediatric hospital settings. Others are child life specialists that work in hospital settings. They provide different things. And then we also have licensed clinical social workers that work in health facilities. And so it's really interesting. There can be many different professions that have a hand and touch these particular clients or patients. But I'll let Dr. Huber maybe reference how that would be different from her perspective and her experiences.
Dr. Mays, I am happy to do that, but I noticed that Dr. Flynn is back in. She's just not spotlighted right now. So let's.
Okay, thank you so much.
Yeah, no problem.
Dr. Flynn, we thought maybe you had a technological difficulty, so it's okay. I'll take it back to you now.
I am so sorry about that. It just cut off on me.
That's okay.
Glad to be back. So I was just going over some typical things that we do on a daily basis. So that's in home, schools, and clinic settings. Other behavior analysts like me work in higher education, teaching, mentoring graduate students, overseeing programs, and conducting research. And the best parts of this work are seeing progress unfold, whether it's a child using a new communication skill for the first time, or a student realizing they're capable of mastering complex concepts. The challenging parts would be the emotional demands and the need to stay balanced. Because we care so deeply about our clients and our students, self-care is essential, taking breaks, setting boundaries, and maintaining a supportive professional community. But it's a very, very rewarding field. Thank you.
Thank you so much for answering that. And I had I'm not sure how much of you heard of the last part. There's a student that sent me a separate private message and asked how much different would it be to work with pediatric patients in a health facility. And so I just kind of briefly described that there can be many different people that impact the lives of children at pediatric facilities. It could be a child life specialist. It could be a licensed clinical social worker, a licensed professional counselor, a clinical psychologist. But I wanted to see each of you, your perspective on this question. How do you think that role of ABA or school psychology compares to somebody working with kids in a health facility? What do you think would be the differences in your opinion?
Dr. Huber, did you want to go first?
Go ahead, Dr. Flynn.
Okay. Let's see. Well, the big difference is, let me think about that. So really, I'm trying to think of some particular examples, but the settings can be quite different because oftentimes, depending on the health facility that we're talking about, it can be more intensive. So it could be individuals with more intense needs. And so that might look a little bit different than what you would see in a school setting or a home-based program or even in the clinic. The clinics, a lot of the ABA run clinics are where students come in and they are mastering behavioral skills, so social behavioral skills. They're mastering skill acquisition. So they're learning new skills. It could be academic skills. I think that would be the main difference between the two types of settings that we're talking about. Hopefully I understood the question correctly. Okay.
Thank you.
Yeah, of course.
Students who have their specialist degree, that's sort of 2 years of coursework and practicum and the 1 year of full-time internship, that's the specialist degree. They almost always work in schools because they get a credential that comes through the State Board of Education. Building on that, if you were to go and get your doctorate, like I have, that doctorate allows you to not only get that credential through the state, but also to be licensed as a clinical psychologist as well. And so in my previous role, I trained doctoral level school psychologists to be integrated behavioral health providers. So they worked in pediatric settings and primary care settings. And it's really interesting because the skills of school psychology fit really beautifully in primary care because it's assessment, it's consultation, it's intervention. And a lot of times when you're working with kids in schools, it's because somehow they need to, somebody wants them to change in some kind of way in order to be successful. And they essentially have to set their own goal and chart their own path to success. And you have to be able to help them do that and not just try to make them be what the adults want them to be. And it's the same kind of thing in primary care, right? You know, the healthcare provider says, here's how what you have to do in order to be healthy. And the patient has to figure out how to what their goals are for their health. Otherwise, they're not going to do the thing, right? And so the skills really did transfer to the healthcare setting. It was pretty surprising. But generally speaking, because of who credentials the people, you probably would not work in a pediatric setting with that first degree as a school psychologist.
Thank you so much. I think you both gave great insight into kind of the nuances and the differences and also some of the similarities between some of those professions. The next question I have for you guys has to do with more of the credentialing and the licensing and the degree that's required. I know that students, they hear about all these different degrees and it can kind of feel overwhelming to know kind of what's next. And so in the past, some students have come to our presentations and they've learned the difference of clinical and counseling psychology. So they know that takes a doctoral degree if they've been to those presentations. And they know the license required for that. They've also heard from people in the clinical mental health counseling program. So they know, like in that program, it takes a master's degree and then where they go on and get that licensure at the state level. But if each of you could share what it is in your profession. And it also sounds like both professions, ABA and school psychology, have almost like a layered levels of certifications or licensures. So maybe if you could explain to that plus the degree, I think that would help the students. And so let's start with Dr. Flynn, and then we'll go back to Dr. Huber.
Sure. So to become a board certified behavior analyst or BCBA, you'll need at least a master's degree in behavior analysis, psychology, education, or a related field. Given that, there are different levels of working in the field. We have students, well, to back up, for our programs in the ABA online department, currently we have a post-bachelor certificate program. So that's a certificate that you can acquire after you earn your bachelor's degree. And that would allow you to have the BCABA certification. And to be a BCABA, you would work under the supervision of a board certified behavior analyst or a BCBA. All these acronyms are crazy, I know, but to be able to work independently without any supervision, of course, depending on the state where you reside, you'll need at least a master's degree. And my department has a master's degree in applied behavior analysis. We actually have two tracks. One is the research track, and that's where students complete a thesis. And that's for students who think that they might be interested in pursuing graduate work beyond the master's level. So if you're interested in getting a doctorate. The other track is the practitioner track, and that's where students complete an applied project. And that's just working with a client, you know, assessing the behavior and developing a treatment plan along with your supervising BCBA. And that track is really for students who don't really think that they want to pursue graduate work beyond the master's, and they just want to get out in the field and start working as a behavior analyst. Not to say that if you choose a practitioner track, you couldn't go on to a PhD program. Yeah, absolutely, that is a possibility. We just usually recommend the thesis for students who are thinking that and kind of prepare them for the dissertation. But yes, you'll need at least a master's degree to work independently. You'll also need to complete specific applied behavior analysis coursework. You'll have to complete supervised field work, and then you have to pass the national certification exam. And some states also have licensure requirements. That's on top of the national certification. Backing up, yeah, the certification is a national certification. So you can take that with you wherever you go within the US. But some states do have additional requirements for licensure on top of it. So if you want to teach, conduct research, or lead programs like I do, you can continue on for a doctoral degree, which would give you the credential of BCBAD.
Thank you so much. And then a couple follow-up questions. If some of our undergraduate students were interested in getting that BCABA, the board certified behavior analyst assistant, I'm not sure if I put those in the right order or not, but if they were interested in that, what would they need to do? They would need to take some post-baccalaureate classes. Is that correct?
We do. We have actually some coursework at the bachelor's level for that certification. And then once that's completed and you achieve your supervision hours, then you can sit for the exam for the BCABA exam. But yeah, we have a program chair in our department who oversees our certificate programs. I do want to say, though, that our accreditation board, our MS program, by the way, is accredited by the Association of Behavior Analysis International. And they are ABAI, the organization is going to eventually phase certificates out. So there will no longer be any certification programs, but we have a few years for that. I think that year is 2032. So we've got a few years before that happens, but just to kind of make you aware of that deadline there, though. But yeah, absolutely. Okay. And even if you're in our master's program and you didn't pursue the post-bachelor certificate, you can apply some of our master's courses to that exam. We actually have some students in our master's programs who they think, well, I really want to get out there and get some experience, you know, as a BCABA. And so they can actually use our courses to sit for that exam as well.
Okay, wonderful. Thank you so much. I appreciate just all of the insight and perspective. One thing I've noticed about the students that come in to our program and they already know they want to go in ABA, they've typically had some type of exposure where they've worked as like a registered behavior technician at an agency or something like that. They have a real passion for the field. They already know about it. A lot of them have some either personal experience or professional experience with children, especially on the spectrum with autism. And that's just been what I've seen. And so I've been really impressed with the students that come in, that they know what they want. They're very clear and they know. So it's pretty neat. There's something about that profession that it's very, it has a lot of depth to it and a lot of, I just think it's been really neat seeing our students talk about it coming in. And so, okay, so over to Dr. Huber, if you could share what degree it takes to be a school psychologist and then the levels. I know you talked about it a little bit, but maybe you could recap.
I did. I did. So one thing I want to say is that a lot of people who go into these fields do it because they love to work with children. And something that you should know is that anytime you're going to work with children, you are going to work with adults. So people who do well in the field of school psychology are collaborative people who work well with others. There are some places, and I thought of it when we were talking about, like a medical setting. Not that medical settings, have to be collaborative, but there are some kinds of medical settings where, it's just you and the kid, kind of thing, where schools are very collaborative places. You're going to be working with the other adults, you're going to be working with the parents and those kinds of things. And that's just a quality that is important if you want to be a school psychologist. And the other thing I think is really important is being people who are like critical thinkers, like problem solvers. That is a trait that is very valuable if you want to be a school psychologist. School psychologists typically are the most highly trained people in a school in terms of their number of credits and their training. Speech pathologists are similar in the amount of training that it takes to be a school psychologist. And this is when you think about some of the other master's degrees that you've heard about. And I think it's because there is all the learning about the sort of mental health side, but there's also the academic side, right? So it's actually more of a comprehensive study of development and all of that and intervention. So imagine yourself, like if you want to be a school psychologist, first of all, the National Association of School Psychologists very much regulates the programs. So anywhere you go and you want to get your degree and get your credential in school psychology, the programs are quite similar. It's going to be 60 plus credits, and they're going to be very similar, the courses that you're going to take. So imagine yourself coming to the Chicago School in Chicago. There's 2 years of coursework. Basically, you come to school 2 days, all day long, and then the other 2 days, you're going to basically be going to a school where you are going through the day with a school psychologist, learning how to be a school psychologist. And so you have the real world experience, you have the classroom experience, and that's 4 of your days of your week. And you do that for a couple of years. And then the third year, you go and 5 days a week, you're on internship. I mean, that's the gist to become a school psychologist. So it's pretty intense. It's also somewhat hard to be working at the same time. So we very much work with students and are flexible and all of that. But we also have a program that we created for people who are working. And so we call it the blended program, where students come to school in person on Saturdays, and then they do other work during the week that is either asynchronous or synchronous virtually around what would be a typical work week. So that's kind of what, and you don't take as many classes if you're doing the Saturday thing. You basically come to campus as many Saturdays as there are credits. So if you're taking 7 credits, you would come to campus 7 times that semester. So we have those 2 different programs, but in terms of what you're learning, it's identical. So that's the 2 years, that's the specialist degree. Now, at the end of that is a terminal degree. And what that means is that most school psychologists across the whole country, that's what they have, is a specialist degree. They do not expect to go on to school any further. It is not similar to other fields of psychology where you expect that you're going to go for a doctorate. People get a specialist degree and they're done. Now, you can go all the way and get your doctorate, and a lot of people do. Because they get their clinical license, they can get their clinical license and their school license. So just one more thing about that specialist level, you can get your national credential and be portable and go, all over the country, just like Dr. Flynn was saying. Now, there are people who go all the way through and get their doctorate. And so those are the two programs that we have at the Chicago School. But wait, there's more. Basically, what we did also, so that a doctoral program is APA accredited doctoral program, we created a post-specialist entry point for people who've been out practicing with their specialist degree who have second thoughts and wish they had gotten their doctorate. So they literally can come back and finish the doctorate. It is the only program that I know of in the country where you can come back and finish an APA accredited doctoral program. So we have kind of 3 different programs actually. But the vast majority of people who are practicing with a school psych credential are at the specialist level, is what's called that 3-year program. One thing I want to say though, like myself and Dr. Flynn, you don't necessarily have to become, go right into being a school psychologist straight from undergrad. It's great if you do, a lot of people do. But the world that we're living in right now, lots of people have lots of different careers. And maybe it's just me because I like a lot of variety. I've done a lot of different things in my life, but it's never too late to become a school psychologist. We've got people who've done all kinds of different things and come back to our program because they decide they want to be a school psychologist. So people of all different ages, all different careers, all different lived experiences are in our program. And the cohorts that are training together are so interesting and vibrant and come to this career because they want to make a difference in the world. And it is so exciting to have them in groups together and preparing to do just that.
Thank you so much. One thing I think that is interesting just from listening to both of you tonight is that all 3 of us started in education with our bachelor's degree. We then went on into something else for our master's and then came back. So my master's is in counseling, but my PhD is in international psychology. But then I came back to teach, and each of you did as well. So I think that's just kind of interesting to see. We all started in the same place and we've ended up in the same place, but our routes were completely different of what we did in our careers. So just kind of a neat observation. The last question I have for each of you before I allow students to ask some questions is, what advice do you have for undergraduate students that are interested in your program? And we'll start with Dr. Flynn. We'll go back to Dr. Huber.
So if you're thinking about applied behavioral analysis as a career, my biggest piece of advice is to get hands-on experience early. And that could look like volunteering or working as a registered behavior technician or an RBT that was mentioned earlier. That's a great entry-level role that lets you see behavioral analysis in action. Also paying attention to what motivates you most. Is it direct work with clients? Is it leadership? Is it teaching or research? So there's room for all of that in this field. You have a variety of choices, but getting out there and getting some experience in the field, I strongly encourage that. Also, be prepared to grow both personally and professionally. Applied behavior analysis teaches you not just how to change behavior, but how to observe, how to listen, and problem solve with compassion and precision. If you love data, applied behavior analysis is the field for you because you'll be working with lots and lots of data, conducting your visual analysis of the data, and observing it in situ or live, So it's a field where science truly meets humanity. It's just such a rewarding field. And so many behavior analysts work with children with autism. You see that the most, but the field's actually branching out to other areas. I mean, our PhD program, for example, has a track in organizational behavior management. And that's for those who are interested in staff performance and motivation, how to keep a fine-tuned running organization that you lead. And so we have some faculty in the department who are interested in even animal behavior and training. So that's what I like about the field, is all those different areas that you can go into. And so whatever that may look like for you, I encourage you to get out there and just get some hands-on experience early. And checking out websites such as the BACB. It's bacb.com. That's our certification board. And that's where you would actually sign up to sit for the exam, the BCBA exam or BCABA exam. Gosh, I'm messing up the acronyms myself. Oh my gosh. But anyway, so yeah, so we have to meet those requirements as well, and also the Association for Behavior Analysis International, and that's the board, the accreditation board that's responsible for accrediting programs. So yeah, so really look on those two websites. There are local chapters, ABA chapters, wherever you are. There's one pretty much in every state. I encourage you to attend conferences if you can, local conferences, just to kind of see what kind of research is being churned out there and where the field is going. There's a lot of different interesting things. And of course, last but not least, I'm happy to talk to you if you want to contact me after this presentation, or any of my program chairs in the department. We're happy to talk to you about the programs and the field. So that's the advice I would give you. Yeah.
Thank you so much, Dr. Flynn. And maybe before we wrap up, maybe each of you could put your contact information of how students could reach out to you in our chat. That would be great. And then Dr. Huber, for you, any advice that you have?
Yes. So the National Association of School Psychologists, it's NASPonline.org, that website, I can put it in the chat, is a great resource to just kind of like read up on what being a school psychologist is about. I personally think the best advice I could give you is to shadow and talk to practicing school psychologists. Every school psychologist's job is different from the next person's. So part of it is, if you work, like there are early childhood school psychologists, there are elementary, there are high school, and the age that you work with, like if you're in a high school, you're going to do a lot more therapy. And things like that. If you're working in, you're going to do in early childhood, you're going to do a whole bunch more play focused kinds of things, or screening for developmental things. It's just you could hardly recognize the jobs across the different age groups. Also, if you're in a rural area versus an urban area. And so all of that variety that I talked about, sometimes psychologists will gravitate towards jobs that where they're doing more of what they like. And honestly, because there is a shortage, as a school psychologist, when you come out of school, you can pretty much have your pick of where you want to go and practice. So even before you go into the profession, I would go and watch and see how school psychologists practice in different places. There's even differences in different states. So school psychology in Illinois it's great. We are a very progressive state in terms of the way that we practice. And so seeing the way that people practice, what a typical day is like for them, and talking to them. I think that's what I would recommend. There are some districts, to be completely honest with you, where the school psychologist literally just tests one kid after another all day long. And you know what? I think back to that guy with his suitcase, I kind of think that was him. I think he was just running around testing kids all day. I don't know why I was afraid of him, but I think that was maybe the job that he had created for himself. So I think that that's what I would recommend. And I have students who love to talk about school psychology. So if you reach out to me and say you want to talk to somebody who's studying school psychology, I got a whole several dozen that would be happy to talk to you about it.
Thank you so much. We have a couple questions in the chat. One I think is for Dr. Flynn. I'm an undergraduate student and just started taking master's classes, so must be in the articulation agreement. What else do I need to do to get the BCABA certificate? And so one student has asked that. Dr. Flynn, is that a easy thing to answer, or would you prefer just to email the student?
Yeah, well, I can generally answer it, but actually I can also put the student in touch with our program chair for the certificate programs too,
Okay.
to give more in-depth information. But yeah, that's absolutely possible. You can take courses for the BCABA exam, again, via the post-bachelor certificate program or the master's program. So there's a couple different ways to do that, but we can talk more in depth about that.
Okay.
I'm happy to do that.
So Sherry Lynn, if you'll just reach out, just to Dr. Flynn, and she'll be able to give you more contact information on that. And then Angela asks, does the Chicago School monitor the pass rates for either the certification or licensure exams for either program?
Okay, I'll start for ABA. Yes, we do. And those are actually published on bacb.com, their website. But yes, and we are at the national average pass rate. Some years we're above it, some years we're around the national average. So, but yeah, they're published on that website. Yeah.
Okay, thank you so much. And then Dr. Huber, do you know anything about the pass rates for the school psychology program with the licensure certification?
I do know that we monitor them. I don't know them off the top of my head,
That's
but
okay.
yes. And because we're school psychology, we have all of the tests that go with clinical psychology and all the tests that go with education and school psychology. But I can tell you that we pass them, and that we have 100% job rate out of school as well.
Well, that's wonderful to hear. And then we only have a couple minutes left. Do any other students have questions for our wonderful panelists? And feel free to take yourself off mute and ask it, or you can put it in the chat, either one.
This has been really fun. I wish we could see you all.
I know.
Yeah.
It's been nice to see Dr. Mays and Dr. Flynn smiling at me while I'm talking, because it would be worse if I was having to just look at my camera. But it would be a pleasure to talk with any of you. So please don't be a stranger. If you're interested in school psychology or have any questions at all, don't hesitate to reach out.
And
Same for
then,
us too.
yep, and I noticed that both of you put your contact information in there. So thank you so much. We really appreciate both of you coming tonight. This was one of our best presentations. It was just very interesting to me to see the connection both of you have for your field, the love you have working with children, but also the very different paths to get there and to do that work. So thank you so much. This was great. I hope everyone that came tonight enjoyed it as much as I did, and have a wonderful evening.
Thank you. You made it very
Everyone.
easy.
Oh,
Yes.
good.
Thank
Good.
you.